what is the process and maybe what are the stages of a dental implant? Stage one definitely is assessment. What's really important in the assessment process is making sure we understand your clinical situation intimately. And this day and age, we've got so many wonderful technologies and tools available to us to get this information. One is in the form of a 3D X-ray, which is CT scan style, where we can really look at the tissues in 3 dimensions and know a lot about their volume. And the second thing that we like to know about is where we want the teeth to be. So in my case, what I often do is an intraoral scan of your teeth and in your mouth and work out where teeth need to be. We need to take a whole bunch of things into consideration, particularly if we're rehabilitating someone's teeth when they don't have any. We need to work out, certainly in terms of cosmetics and where we want things to go, and that dictates where the implants need to go. That process is critical. Stage 2, if everyone's happy with that, we usually go ahead and discuss this in far more detail, and we've obviously got to introduce some different options and costs and talk about alternatives as well that you do need to consider before you can make your decision. Stage 3, if you're happy with all that, is the actual surgical procedure itself. This is done in a sterile environment with drapes, etc., where we place the implants basically where we've planned them. This is usually done under a local anaesthetic. Some cases we do consider working with some oral surgeons or even doing them in a general anaesthetic environment. It's always possible as well. Stage 4 is when the implants have been placed, we always need to leave them and let them undergo that process of what we call osseointegration. And that's the process where the implant itself fuses to the jawbone and becomes ready to load. And that process for most cases, not all, but most cases is 3 months. So we want to leave those cases alone for a little while and let them heal before we do anything else. Which brings us then to the 5th stage, which is the restoration. So whether it's a single tooth or whether we're doing a full mouth rehabilitation with dental implants, that's the restorative stage, comes right at the end, and that's where that process goes, and that's where that process finishes, because that's the end stage. But from there, what becomes very important, and probably in my mind equally important to all this, is the review and the follow-up. These cases are not a sit and forget. Dental implants, whether it's a single tooth or a full mouth, do require maintenance, just like teeth do. It's irresponsible of us to be putting these things in people's mouths and not making sure that they have their best chance to provide a very good clinical longevity. So we're very involved in making sure that process of review and maintenance is key moving forward.